Hello viewers, welcome back to another TV channel. If you have not subscribed, please click on the red subscribe button to do so, and then bring in your comments so that we can discuss and then like and share. Today we'll be discussing about areas in nursing. I'll outline some of the areas in nursing so that those that want to venture into nursing will know their area of interest and where to venture into. One of the branches of nursing or branches in nursing is mental health nursing. These are those that work in a psychiatric hospital to deal with patients that have mental health issues. Then we have the pediatric nurses. Pediatric nurses work in children's ward to take care of kids with their diseases, to help out in their diseases, administration of drugs and all that. But they work with children. Pediatric nurses, they work with children. Then we have the emergency nursing. We can also call them A&E nursing, like accident and emergency nursing. These are those that deals with those that have road traffic accidents or any form of accident at all. They are the ones in charge of any emergency cases that deals with maybe difficulty in breathing, bleeding disorders and all that. So they are the ones in charge of that. Anything called emergency is being taken care of by emergency or A&E nurses. Then we have nurse researchers. These are those who go maybe venture into researching work. They go into places, communities and all that, trying to identify diseases, the causes and how to tackle and deal with it. They maybe produce journals, they produce handbooks, textbooks, different kind of books, articles for people to read about health-related matters. Then we have the travel nurses. Travel nurses, that is what we call traveling health, something like that. Like what they do mostly is they travel to take care of people's health. Imagine that the hospital setting is here and there is a call that they need a nurse to attend to. Most times they send the ICU nurses or the emergency nurses to go and take care of such cases. And most times they pay them for the travel allowances, food and accommodation. They pay for all this. Then we have nurse midwife. These ones, they stay in the labor ward to take delivery of women that are in labor. That is their main role. Then we have general nurse practitioner. What they do mainly is like they do general, just like we have general practitioner in medicine. Same we have in nursing. So they just do the general role, but they don't have any specified role they do. They just do roles like maybe serving of medication, dressing of wounds, and then checking of vital signs. These are the kind of roles they perform. They perform the general role in health sector. Then we have nurse, gynecological and obstetric nurse. Yes, the gynecological and obstetric nurse, they work to help doctors like gynecological and obstetric doctors to deal with women maybe who have a miscarriage and then they want to like do MVA. That's what we call MVA. That is manual vacuum aspiration. They do it to evacuate the remaining content if the fetus is not viable or dead already. So they do MVA to expel the remaining content. So that is their main. So the next is orthopedic nurses. They deal with those that like have bone fracture, like osteoporosis, osteomyelitis and all that. Anything that has to do with the bone, the orthopedic nurses do so. Then we have nurse manager. They work in the hospital, that is in the clinical settings, to supervise those working in the hospital to know how they are running the hospital affairs. Then we have gerontologic nurses. They deal with the old, the aged, to take care of the old people in order to maintain the quality of life. Then we have nurse advocates. They are the ones that like go on behalf of the patient to deliberate on issues concerning their health. Then we have nurse informatics. What they do mainly is to record patient data into the computers, like for example, the diagnosis of the patient, the vital signs, the line of treatment, other procedures performed on the patient, and so on and so forth. This is what they record into the computer to ensure the quality of life. Then we have NICU nurses, that is neonatal intensive care units. That is where they work in for children that are, let's say, neonates from 0 to 28 days. Those that have health related issues like tongue tie, difficulty sucking, and all those, a whole lot of things. So they are the ones that take care of children from that age, from 0 to 5, that is from birth to 28 days, that is 1 month of age. They are the ones that are being placed in the neonatal intensive care units. Family health professional or family nurse practitioner. What they normally do is they take care of patients in their homes. So like they're being like assigned to take care of patients. For those that require such care, they take care of patients in their homes, doing the vital signs, setting of medication, and then doing every health related or procedures in the hospital. The ones that have been done in the hospital, they also do it at home for the patient. For those that need or require or request such care, they do it for them at home. Then we have oncologic nurses. Oncologic nurses, what they do is they take care of patients with cancer. Patients with cancer, that is their main role. They are the ones that are in charge of that, oncologic nurses. Then we have nephrologists, nephrologic nurses. What they do is they take care of patients that have kidney problems. That is their main role. They take care of patients that have kidney problems. Then we have anesthetic nurses. What they do is, like, in fact, without them, surgical team will not be complete. Without the anesthetic nurse, surgical team is not complete. Without them, surgery cannot even be done. What they do mainly is they give anesthesia. There is an injection called anesthesia. They give the anesthetic agent to make the patient calm or sleep for the surgery to be performed. Some you give at the spinal to, like, depending on the site of the surgery or operation, you give the injection in that location to kill the nerves around that area. If it is around the abdominal region, for the surgery to be performed without the patient feeling pain, or they give the general anesthesia for the patient to sleep off for the surgery to be done. Then we have the theater nurse, or we call them scrub nurse. Scrub nurse, what they normally do is they are the one that sets the theater ready for the surgery. They are the ones that assemble the instruments, call the surgical team that the theater is ready for the patient to be brought in. They are the ones that count the surgical instruments to ensure that none is left inside the patient's body before closing up or suturing the sites, the incision site. So these are the main areas in nursing. I don't know if I've mentioned public health nursing. What they do is go to teach communities about health-related matters, and also to advocate for them, teach them things. Their main role is prevention of diseases. Thanks for watching. Keep tuning in for more videos on Adorable TV channel. Till we see ourselves next week. Thank you.